Hi there, I'm Jimmy Innes. It's the 12th of May. I'm sitting in my bedroom and it's the 7th week of lockdown here in the UK. Everything that's happened in the world so far over the last 4 to 5 months, with those 4 to 5 million infections, with those 290,000 deaths around the world, what we know is that we're about to see that all happen again in the developing world. At least that's the best case scenario, is everything we've been through already happens again. Best case scenario. One thing is certain, in the developing world, the hundreds of millions of people living fragile lives are the ones who are going to bear the brunt. For us at International, of course, that means supporting people with disabilities in the COVID-19 response. We know for a fact that people with disabilities around the world are disproportionately affected by the impacts of COVID-19. And we know for a fact that people with disabilities are disproportionately excluded from the response to COVID-19. For us at International, we're working tirelessly to help improve access to basic information in accessible formats for people with disabilities. We're helping to ensure that people with disabilities have access to social support measures whilst in lockdown. We know that people are having a difficult time in this scenario. We're trying to ensure that basic food packages, hygiene packages, social support, psychosocial support is available for people with disabilities during this time. At International, we're very concerned that people with disabilities have access to fair, equal and equitable healthcare provision, but we're worried that they're not getting that. In many countries around the world, we're seeing cases of discrimination against people with disabilities being turned away from hospital, from treatment, because of their disability. That's unacceptable. And at International, we're concerned with the economic impact. In the countries where we work in Africa and Asia, the majority of people with disabilities rely on an informal hand-to-mouth economy, informal livelihood. Now, these informal livelihoods are effectively already dried up, and the impact now and into the future is going to be very difficult for people with disabilities. So today, we're launching our COVID-19 appeal to help support a disability-inclusive COVID-19 response in the countries where we work in Africa and Asia. And I'm asking you, in spite of the 4 to 5 months that we've lived through that's changed our lives, and in spite of the 7 weeks of lockdown and hardship that we've endured here, and all the worry and concern and uncertainty that has brought us, as well as the personal hardship and grief which we've all lived through in our own ways as well. In spite of these things, I'm asking you to give what you can, if you can, to help support that disability-inclusive COVID-19 response, because there are hundreds of millions of people with disabilities in the countries of Africa and Asia whose lives are fragile, who are bearing the brunt of this pandemic and will continue to do so disproportionately unless we can up our game and provide more support to help ensure disability inclusion is at the heart of the COVID-19 response. Thank you.